what is the evidence that people with schizophrenia do in fact recover?
Research has shown that even people with long-standing illnesses where they may be hospitalized for years, 5, 10 years, can recover if they are able to receive good treatment and rehabilitation, both in the hospital and after leaving the hospital. For example, there are studies in Germany, in Japan, in the United States, in England, showing that large numbers of people who've been hospitalized and have had their symptoms for 5 or 10 years, with the good treatment and leaving the hospital, about 50% of them, and even more in a couple of studies, meet these criteria that I've indicated, are examples of a person being able to live a normal life. One study was done in Vermont where people were discharged, people with schizophrenia were discharged from the Vermont State Hospital. They were followed up 30 years later, 25 to 30 years later. Many of them were in their 50s or 60s. And careful interviews were done. People were found in the community who knew them, so it wasn't just the report or the description by the individual that might not be so reliable. And they found that 68% of those individuals had no major symptoms that were interfering with their daily life. They were working or having normal kinds of volunteer activities in the community. They had friends. They were participating fully in community activities. And so they met the criteria for recovery. They were managing their illness. Occasionally they would have to see a doctor, but many of them were able to bounce back even from a relapse. Now we have to know that, we have to understand that all illnesses, all medical illnesses, are subject to relapses if there's enough stress. So if a person has high blood pressure and the blood pressure is controlled by medication, if there's enough stress like a new job or some disaster or loss in the family, blood pressure can rise. And so individuals, by keeping track of their blood pressure, can get the intervention, the medical intervention, change in medication, or some type of support that will enable the blood pressure to come back down again. The same thing holds for people with schizophrenia. Now, individuals who are younger and have, let's say, their first episode of psychosis, they recover much faster. It doesn't take 15, 20, or 30 years. In our clinic here at UCLA, where we have young people with a recent onset of schizophrenia, with the treatment we offer here, where they're learning about how to take care of their illness, they gain insight into their illness, they use their medication on a regular basis, they see a therapist, they see a psychiatrist every 2 weeks or 3 weeks. They recover, or a large number of them recover within a year. 90%, over 90% are back to school, normal schools, maybe not going full-time at first, but they're back in college or back in high school or working if that's their personal goal, and they have symptoms that are really not interfering with their everyday life. But the important point here is that treatment for schizophrenia, as it is for any serious medical illness, has to be continuous. It cannot just stop. And unfortunately, given the scarcity and the limitations in treatment that's available in Los Angeles or any city or rural area in the United States, the quality of services, the continuity, the comprehensiveness necessary for rehabilitation and recovery, unfortunately, are really not present.
Great.
So the limiting factor is not in the capacity to recover. It is in the treatment and rehabilitation that's necessary for recovery.